It's early morning and you're sipping coffee on a ship deck, feeling the sea breeze. You think of a ship as a safe floating resort until the unseen happens. Imagine a silent virus creeping through shared cabins and dining halls, like a stowaway in the air. Hantavirus, a name you've barely heard, suddenly becomes the nightmare. On deck. Hantaviruses are rare viruses carried by rodents, but Andes virus found in South America is special. It can spread from person to person. On April 1st, the MV Hondius left Ushuaia, Argentina, for a polar voyage. 20 days later, nobody expected a health crisis. Then passengers fell ill with fever and cough. 3 died on the trip, and others grew seriously sick. Scientific teams from WHO and the CDC rushed to investigate. DNA tests confirmed the culprit was Andes hantavirus. This virus can cause hantavirus pulmonary syndrome, a severe lung disease with flu-like start. Within a week of the first deaths, health authorities knew this outbreak was grave. WHO reports 8 cases so far and 3 fatalities. The case fatality rate for Andes hantavirus is high, around 40% for severe patients. In everyday terms, that means nearly half of those who get very ill may die without treatment. Right now, fleets of experts monitor every move of the ship. This is an active crisis. Passengers disembarked under strict quarantine on May 10. Then evac flights flew patients to hospitals. Americans went to Nebraska. Others to Europe and Africa. On board, 2 medical teams are watching the last 27 crew members closely. None are sick yet, but they remain isolated as the Hondius heads for Rotterdam. Before we go further, have you ever been on a cruise where you shared tiny space with hundreds of strangers? Drop your answer in the comments. I genuinely want to know what you think. Now ask yourself, what force caused this panic at sea? In science terms, hantavirus is a zoonotic virus from rodents. It lives quietly in urine and droppings and only shows up in humans when they accidentally breathe it in or touch it. To make sense of it, imagine the ship as a giant fish tank and the virus as invisible algae. You don't see it until it blooms and suddenly the water is toxic. The cruise ship was a tight network of air and surfaces, just right for germs to move. Health officials stressed no broad contagion has happened yet, but everyone on board is considered exposed. A key fact. Andes virus is unique among hantaviruses because it can spread between people given close, prolonged contact. It's as if one sick person's cough can seed the virus onto others nearby. Most hantaviruses don't do that. They stay rodent-bound. Here, it's as if nature broke its own rulebook, but early symptoms felt like nothing, just fever and aches, so passengers went about their routines. That delay made containment hard. So the big question for this video is, how did this happen and what happens next? In recent centuries, ships with illness on board have made headlines. In 2020, the Diamond Princess cruise ship off Japan was famously quarantined for COVID-19. Out of 3,700 people on board, 712 tested positive, about 19%, and 9 died. Like antennas catching a storm, the disease scanned every cabin until it found new hosts. That outbreak taught us harsh lessons about ships being petri dishes at sea. It's no fluke that almost every year brings news of a norovirus stomach bug or other illness on cruises. Another event, in 1994, a cruise ship Horizon out of New York had a Legionnaire's disease outbreak. 14 passengers got very sick after using the ship's whirlpool spas. They discovered the disease spread through the ship's water system. The cure was to sterilize the ship completely. That was the first time Legionnaire's disease was linked to a cruise ship. It showed that hidden plumbing can harbor danger on vacation. The lesson: history is not a warning. History is a pattern, and this pattern is still running. Now let's return to the present. According to WHO's May 8th update, 8 people from the Hondius crews have now fallen ill, and 3 have died. 6 of those cases are lab confirmed as Andes hantavirus. The others are suspected after testing. WHO calls the risk low for the world population, but moderate for those on board. In plain language, the virus is not about to spread everywhere, but anyone who was on that ship or in contact with a patient is right now considered at risk. CDC authorities are on high alert too. The US CDC activated emergency response, with teams on the ground in the Canary Islands and awaiting evacuees in Nebraska. The CDC reminds doctors nationwide to watch for this rare disease, even though no local cases have occurred. They pointed out something every traveler should know: risk to the general public in the United States is extremely low. That means you don't need to cancel your holiday. The odds of you catching this on land are tiny. Still, data is data. Each number tells a story. The ECDC reports that as of May 15th, 11 people linked to this ship's journey had developed illness, including 8 confirmed with Andes virus and 3 total deaths. And importantly, no new cases have emerged in the last few days. So things aren't exploding uncontrollably. The outbreak has been identified and people are isolated. But 11 cases is a lot for such a rare virus. Doctors have now observed how a disease that normally hides in rodents can suddenly jump between humans in the right conditions. What is the science behind hantavirus pulmonary syndrome? HPS? It's a bit like the flu in a storybook. Early signs: fever, fatigue, body aches mimic a cold or flu. Many patients get headaches, muscle pains, even mild stomach upset. Days later, it can suddenly escalate to severe coughing and low oxygen levels as the lungs fill with fluid. When that happens, patients can crash quickly. They may need an intensive care unit for breathing support. In the Americas, about 1 in 3 people hospitalized for HPS die. No vaccine or antiviral is yet available. Care is all about supporting the patient's breathing and blood pressure until they can fight off the virus. We've seen how fast this can move on modern ships. Each guest on that cruise is being tracked. Around 20 countries have started screening or quarantining anyone who disembarked from the Hondius. For example, in the US, 18 passengers were taken to quarantine units, 15 in Omaha and 3 in Atlanta. 1 person there actually tested positive, 2 are in serious care. The rest are symptom-free but held in isolation as a precaution. The Nebraska hospital described their rooms as comfortable with a TV and bike, but still like a bubble cut off from the world. That's an example of first-order impact. Suddenly, a few travelers are hospital cases far from home. Then come the second-order effects. The ship's arrival was delayed. Plans to resume the journey or go home were canceled. Tourism plans fell through. Airlines had to coordinate flights to repatriate passengers safely. Cruise operators worldwide are reminded that an outbreak can strand people anywhere. Economically, stranded cruises mean lost revenue. Psychologically, it breeds fear on passengers and crew. We may see more travelers canceling cruises or ports enforcing stricter health checks. Meanwhile, crews across the industry will be on edge. Beyond the ship, what's at risk? Global health watchers are analyzing every handshake and boarding pass. Remember the man who disembarked on Ascension Island, flew to Switzerland and fell ill on May 1st? He isolated right away and is in good care. But if he had been careless, he could have spread it further, possibly infecting people on his flight. International contact tracing is trying to prevent just that. That Switzerland case shows a cascading chain. A person healthy at sea becomes sick days later in another country. Each step along that chain can potentially send the virus farther around the world before anyone notices. Yet experts stress, this is not a horror movie with panic going global. The WHO and CDC are very clear that this is a known virus with no evidence it's mutating or spreading freely by air. They want us informed, not scared. Everything you are hearing is based on verified data from the WHO and the US CDC. This video is made for awareness and education. It is not a prediction that disaster will occur. Science deals in probabilities, not certainties. Our job here is to understand what the evidence actually says. Looking ahead, there's a critical window of time. The next few weeks will determine how bad this gets. Patients still in ICUs have a fight ahead. Medical teams in South Africa, the Netherlands, and Switzerland will see who recovers. Even those quarantined may still develop symptoms up to 42 days after exposure. Every day without a new case is hopeful, but the clock isn't up yet. Now, what about preparedness? Are our systems ready for this kind of crisis? To their credit, agencies responded fast. The CDC deployed experts to the Canary Islands and the Netherlands, advising officials on quarantine procedures. The WHO already has a ship sanitation manual and sent guidelines specific to this outbreak. The ECDC and RIV Netherlands Health Institute released advice on testing and contact tracing. Ports now have protocols. Any ship with unexplained illness must report and hold. Quarantine hospitals exist in many countries, prepared for biocontainment. These measures work because they stop the virus at checkpoints like nets catching fish. However, limitations are clear too. Cruise ships aren't hospitals. They have small clinics for basic care, not ICUs. Many ships are registered in countries far from where the outbreak is detected, so oversight is patchy. The vessel sanitation inspections mostly focus on food and cleanliness, not airborne pathogens. International health regulations do require reporting, but enforcement can lag. Funding for global outbreak teams is stretched thin, since many threats compete for attention. In the Americas, for instance, public health labs can test for common viruses, but Andy's hantavirus testing needs specialized PCR. Only a few labs worldwide handle it. One lab in South Africa ran a key test. Another in Switzerland helped confirm cases. That coordination is good, but it took precious days. Also, repatriating sick cruise passengers across continents is logistically complex and expensive. The United States has biocontainment units at Omaha and Atlanta hospitals, but other countries may not. What if cases had arrived in regions without such facilities? That's a gap. So what can you, the listener, actually do? First, stay informed but not alarmed. If you're traveling by ship or plane or bus, remember basic hygiene. Wash hands, avoid touching your face, and get fresh air when you can. Avoid wild rodents or their droppings if you're anywhere near forests or farms. They are the natural hosts of hantaviruses. Don't haphazardly clean cabins or restaurants without masks if advised. Listen to health authorities. If you were on that cruise, follow the instructions of medical staff. Most importantly, think realistically. In 99% of cases, you won't meet Andy's virus on vacation. But your awareness can stop a chain. If you fall ill after travel, seek medical help and mention where you've been. Simple information like "I was on that cruise ship" can alert doctors. Beyond individual actions, remember the bigger picture. The natural world and our world are one system. This virus likely jumped from rodents in Argentina to humans, then rode our global transport network. It shows how human travel can outpace nature's checks and balances. The ocean, air, and land are connected. A disease sparked in South America can end up in Europe on a cruise ship. That means our fates are tied. Here is the question I will leave you with. How prepared would you feel if something like this happened in your home? Region? Not the official answer. Your real answer. Write it in the comments. I want to read every single one.